Goldenseal, Hydrastis canadensis, in the family crowfoot, the Ranunculaceae. If you look at the leaves of any plant in the crowfoot family, they're going to vaguely resemble the foot of a crow. And so that's one way to differentiate those. They are called Hydrastis because of the affinity for moist soils. Hydra, meaning water. And canadensis is part of, Canada is part of the natural distribution of the plant, but perhaps it would be more appropriately called Ohioensis because actually it is native to the Ohio River Valley, and that is the place of the highest genetic diversity, which means that it's basically the gene center of the plant. The plant has been growing in the Ohio River Valley longer than any other place, with the possible exception of the Ozark Plateau, which is this limestone-rich, hilly feature which stretches from Missouri through Arkansas, Oklahoma, and into Kansas. The plant prefers a moist forest soil of pH 5.5 to 6.5. Goldenseal, because the stem scars left from the previous year's growth somewhat resemble the wax seal that people used to use to seal their letters. And golden is self-explanatory here. You can see the rich golden color of the root and also the stem as far as that goes. And this is indicative of the presence of the alkaloid berberine, one of the three isoquinoline alkaloids, three main isoquinoline alkaloids that are found in the plant. The other two are hydrastine and canadine. So these alkaloids, this plant as a whole, has numerous applications in herbal medicine. And it is really, really, truly one of the best. You can find other plants that contain berberine, but they don't have the same astringent quality that Goldenseal has, so they're not really a valid, complete replacement for the activity of Goldenseal itself. Wound healing, digestive bitter, treats diabetes, staphylococcus, good for treating colds and flu, sore throat, tonsillitis, conjunctivitis, it's a specific for conjunctivitis, sinusitis, leukorrhea, which of course is whitish vaginal discharge, uterine bleeding, oral thrush. It's basically antibacterial and antiseptic to the max. So berberine itself is antimicrobial. Hydrastine is, among other things, astringent to the mucous membranes. So you have this kind of dynamic duo of shrinking the swollen, globby tissues that are oozing and infected and creating less surface area for bacteria, and then also the antimicrobial activity of the berberine. Canadine itself is antimicrobial to bacteria, also fungi and protozoa. So sore throat, a lot of times you think it's caused by a virus, but it may be a virus that's developed into a bacterial infection, and there can be a fungal infection involved as well. That kind of white netting that you see on a sore throat oftentimes is actually a fungal growth. And so the canadine aspect of the plant is significant in that it has the antifungal effect. So there's another little detail about the plant, which is that the whole herb, that is the root and the leaf, has a better activity against infection, including Staphylococcus aureus, than just the root. And most herbalists just use the tincture of the dried root, or it's known as the root, but it's actually the root and the rhizome, isn't it? But if you combine the leaf, then you get a significant anti-inflammatory effect, and also the leaf contains the inhibitors for the efflux pump. The efflux pump is a little vacuole in the bacterial wall, which basically pumps out anything that might kill the bacteria, in other words, in this case, the berberine. And so if you include the leaf tincture with the root tincture, then you disable the efflux pump, or inhibit the efflux pump, and the berberine works a lot better, and the bacteria then dies. So a couple stories. One is that a neighbor lady came to us hoping for help for her daughter, who had a terrible case of bacterial conjunctivitis. And as you know, this is like pink eye. It's like this the swelling of the ocular area, a lot of weeping of putrescent, yellowish exudates. She had tried the typical Western medicine approach, which is to treat with antibiotic drops, and had absolutely no success. So we gave her Goldenseal root tincture, and she mixed that up with isotonic water, which is basically clean water that's treated with a little bit of salt to be similar to your body fluids, blood or tears, and then obviously drop the Goldenseal drops in there, and used an eye cup, inverted the eye cup with the tincture, dilute tincture over the eye, and the kid was cured within a day. So she was extremely grateful to us. Then another little story, which is that I was in the lab and I had been working with Goldenseal, squeezing out the press cloth to get the last few drops out of the Goldenseal tincture that we were producing. And I happened to, the lab technician happened to be running HPTLC on Goldenseal. And so he wanted me to see the way that the different alkaloids had eluted on the slide. And he had it under an ultraviolet light, which makes the different lines of the slide phosphoresce and makes it very clear as to what you've got. So the slide kind of slipped to the side a little bit, and I reached under the ultraviolet light with my hand to adjust the slide, and my hand phosphoresced very actively. And what this indicated to me was that basically Goldenseal has this quality where it can cling to the skin or to the mucous membranes, and it lasts a long time. And so this kind of shocking phosphorescence of my hand taught me something about how long Goldenseal really remains on the skin, and what a important aspect of the treatment that is. If you gargle Goldenseal water for a sore throat, which is really the primary beginning treatment that most herbalists and home home herbalists, medicinal practitioners will use, then you're coating the mucous membranes with the active principles of the plant, and they're going to stay there for a long time. A few little agronomic aspects. So it'll take 40 to 70% shade. Needs more shade when it's in the early stages of growth, less shade as it matures. All plants eat light, so you want to make sure that it gets enough light, even though you're also making sure that it doesn't burn out in the full sunlight. Then it grows best in forest soils, so inoculate your compost with mulch from the forest, and that'll provide the fungal symbionts that make Goldenseal be really, really healthy. So we've also compared wild simulated, that is Goldenseal grown in beds in the forest, with actual wild plants that were harvested from wild stands versus plants that were grown in pots in the greenhouse, as we're seeing here, or in the shade house, and found that the activity of the three different plant samples was pretty much identical. So you have a lot of options with growing the plant. One of the best reasons for growing it in pots in a shade house like this is that it protects the plants, keeps them from getting weeded up, allows you to take care of them on an ongoing basis, not forget about them as if they were out somewhere in a forest situation where they might get stepped on. But then the value of growing in the forest is that the plants will eventually spread. They're capable of rhizomatous spreading, and they'll make a patch, and so over time you'll get more yield that way. I'd like to just promote for a second my various books that deal with Goldenseal. Making Plant Medicine will give you the recipes for making the Goldenseal tincture of the root and of the aerial parts. Then Growing at Risk Medicinal Herbs will give you an in-depth view of all aspects of Goldenseal, including planting from seed. The black seeds are inside this drupe. Those must be kept moist and planted immediately in the natural farming technique method. You just plant the seeds when they're ripe immediately. You plant them in the mineral soil, and then you cover with mulch. So that's all going to be very clearly explained in Growing at Risk Medicinal Herbs. Then also Growing Plant Medicine volumes 1 and 2. The Goldenseal monographs are actually in volume 1, and this will give you further perspective on growing this plant, which is the poster child of American herbalism and deserves our great attention so that we can continue to use it without running out of it.